Hello, everybody. My name is Ken McGee, and I am a graduate student at Auburn University. I'm going to talk about a response to the COVID-19 vaccine. I would like to address um, directly to the U.S. federal government, um, policymaker, and state and local um, health agency and pharmaceutical company. There are over 10.6 million coronavirus cases in the US alone, and 242,000 deaths since this whole pandemic has started because of the virus. We have lost so many lives to this awful virus, and now we're talking about possibly having a vaccine that will give hope to so many people across the nation. The vaccine is developed by Pfizer, which is a German based company, and the vaccine is found to be 90% effective. The study enrolled 43,000 participants around the world, and with 42% having diverse background with no serious safety health concerns. Submission for emergency use authorization to U.S. Food and Drug Administration (FDA) planned soon after the required safety milestone has been achieved, which is currently expected to be happen sometime this month. It is a two-dose vaccine. The first dose, there are some side effects with the vaccine, and you can expect to have a lot of headache, a lot of fatigue, pain at the injection site that will last for about 24 hours. The pain in the injection site will actually last for about 72 hours. The second dose is giving 72 hours. The second dose is giving 3 weeks after the first dose, and it is more muted and it's not as strong as the first one, so the symptoms and the side effects can be managed by taking Advil to help with the side effects. Recently, Lieutenant Paul Ostrowski, director of the Operation Warp Speed, stated that they're working with the local in every state to make sure that they are ready to go whenever the vaccine is approved by FDA. But the state immunization managers, they feel like they're not as ready, just because the vaccine is very complex and it requires special handling. The vaccine has to be stored at negative 75 degrees to make sure it is effective and it can be given safely. So now the question is, who will get the vaccine first? There are certain priority group like frontline healthcare workers that deals with COVID-19 patients daily, and people that have underlying medical conditions. They will be the first one to get the vaccine. Dr. Fauci stated that this can happen any day. It can be today, or it can be tomorrow, it can be next week, it can be end of the year. Other people that does not fall in these high risk category will probably have to wait until the spring to get the vaccine. But once the vaccine is distributed, how will it be decided to as far as to see how much it goes to each state? Because there won't be a huge supply at first. That will have to be decided, and there is another political aspect of this whole process. Now, CDC recommends that with the upcoming holidays like Thanksgiving and Christmas, to only celebrate with people within your household, to keep it at a minimum for gatherings, only with the people in your household. Vaccine is not a cure. So I'm proposing that we still wear masks, We still practice social distancing. We still wash our hands. We still have to do temperature checks to make sure and limit visitors at the hospital and nursing home and assisted living facilities. We all want to get back to some kind of normalcy with our lives, but we still have to be cautious with this virus. Thank you so much, guys, for your time, and I hope we can all work together to fight this virus.